Hi, I'm Clarice Grody. I'm an occupational therapist, Medicare specialist, and the founder of Amplify OT. Welcome to Amplify OT Q&A. Today, I'm answering a question from one of my followers. They're an international follower, asking the difference between a diagnosis and an evaluation. Now, here in the United States, technically speaking, occupational therapy practitioners are not eligible to diagnose a patient in our scope of practice. However, we do provide evaluations. Now, here's where things can get confusing. An evaluation is really the process of which you come to diagnose what kind of therapies the patient may need and what types of symptoms or, disorders they may have. So the evaluation is really the process of identifying whether or not the patient requires therapy, whether or not they require skilled services. And this is where you're going to be issuing some of those examinations, completing an occupational therapy profile, establishing their plan of care, etc. The diagnosis is really when you're identifying what the issue is. And the way to identify the diagnosis is through the evaluation. So they are linked, but they are not exactly the same thing. So you can't really have one without the other, because otherwise, how would you know you're providing the right diagnosis if you don't first complete some sort of evaluation to whether you are establishing what it is and what it's not. Now, even though occupational therapy practitioners are not necessarily eligible to diagnose in the traditional sense, occupational therapy practitioners do complete what we call like diagnostic tests. And so this is this process of providing screening tools and assessments to identify what an issue is. Now, generally, we already will know that there is some sort of issue. So one of these common examples I like to provide is where when a physician refers a patient to outpatient occupational therapy with shoulder pain. Shoulder pain is obviously extremely generic. There are thousands of different factors that can cause pain in the joint of your shoulder. But the physician there is really trying to have the occupational therapy practitioner in this situation, typically the occupational therapist, identify what the exact cause of that pain may be. So the physician has already given them the diagnosis of pain in their shoulder, and the occupational therapist then during that initial evaluation would be completing different diagnostic tests and assessments to try and identify what the exact cause is of that pain. So whether or not it's a nerve pain, is it coming from your neck? Is it a muscle tear or things like that, or some sort of instability, trying to identify the specific issues that are contributing to this diagnosis of shoulder pain. And then that's where the occupational therapist would then be able to collaborate and communicate with the prescribing clinician or the physician about what their findings are. And so therefore the patient is able to achieve more of a formalized diagnosis. And then you're able to further explore what the treatments are and those sorts of things. And so even though a diagnosis and evaluation are related, we may already know the diagnosis before completing an evaluation because the physician has already completed that initial diagnostic testing, or the occupational therapy practitioner may be tasked with kind of finding a more specific root cause and more specific diagnosis through the evaluative process. So I hope that helps. I hope that makes sense. Feel free to ask me any questions. Again, I'm Clarice Grody, and I am founder of Amplify OT. So you can always visit my website, amplifyot.com, or send me an email. Thanks for watching.